Welcome, everyone. Thank you for joining us for the webcast, Smarter Compensation for Healthcare. Elevate your HRIS with HRSoft, sponsored by HRSoft. This webcast has been pre-approved for HRCI and SHRM credits. Please be sure to attend the complete webcast in order to receive your credits. You will receive an email from hr.com within 2 business days. It will include the certification credit information. You may also log into your account and view the credits that you have received. If you have any questions during the webcast, please click on Q&A in your webinar controls and type them in. And now it's my pleasure to turn it over to our presenter, Glizcel Ditto, to get us started.
Thank you so much, Kathy. Hi, everyone, and welcome. We're so glad that you could carve out some time for this. If you're working in the healthcare compensation space right now, you already know that the pressure is real. Turnover's up, budgets are tight, and the competition for clinical and scientific talent is fierce. So today we're going to talk through what's actually working. And to dig into this, we brought together 3 perspectives you don't often get to see in the same room. I'm happy to say that we've got a practitioner kind of living this day to day, a workforce data expert who tracks these trends across industries, and me representing the technology side of this equation. I'll let the panel introduce themselves first, so I'll pass it over to you, Erika.
Thank you so much. Hi, everyone. My name's Erika Sandoval, and I'm with the UKG Human Insights team. I'm excited to be here with you all and with Matt, especially, who's living this every single day. I'm here to talk about really the expertise on what are these trends that are shaping the world of work and helping organizations. My background is in HR many moons ago and organizational effectiveness. So today I'm excited to bring the broader workforce and employee experience lens to this compensation conversation. Thanks.
Thanks, Erika. And Matt?
Well, let's say it's happy noon, good morning, good afternoon, depending on where everybody is at. And my name is Matt Stensland, and I'm the Director of Compensation for Acadia Health, which is a large behavioral health system across the US. I've got 20 years of experience and intermingled with comp, HR operations, have pretty much done almost every job in HR. So I get the benefit of coming from different pieces of experience to be able to kind of have this conversation with everybody today. I have been with Acadia in 8 months, so I'm fairly new, but I have worked in large health systems over the years, Tenet Health, Monsecure's Mercy, Presbyterian Health. So my healthcare experience is pretty deep, and I'm excited to talk a little bit about my experience and what I've found and potentially hear from you all as to what you're doing, because that's exciting as well.
Perfect. Thank you so much. And I'm Glizcel Ditto. I lead the client solutions team here at HRSoft, and I also represent some of my broad compensation consulting and practitioner background into the mix as well. So now that we know who's in the conversation, I want to talk a little bit about why it matters right now. Here's the backdrop I think we're all operating in. This is all based on some recent studies from NSI National Healthcare surveys, and basically looking at things like hospital-wide turnover across all roles being at around 18.5%. RN turnover in particular is at 17.6%, but what's significant about that, I think, is that there's been an increase, the first year-over-year increase since the pandemic, and that's something that we need to be aware of. And then the added cost to an average hospital from last year's turnover uptick is around $360,000, so it's not something to balk at. I'd say that last piece also that's very interesting is the new hires at hospitals are leaving within the first year at a rate of 29.5%. So those are all pretty significant based on these particular studies. And to tackle this, these are the areas that we want to kind of cover today in our conversation. So looking at this workforce crisis and why comp tech matters right now, managing complexity across the organization, and different ways that we're looking at retention as well, and benchmarking and data and such. And then we'll have some time at the end for some Q&A. So before we actually get into some of the nitty-gritty of this, I want to kind of open this up to the two of you. What's the single biggest shift you're seeing in healthcare compensation right now? And I'll start with you, Matt.
Absolutely. Over the last many years, we used to focus on like an annual competitive reviews, provide budgets for our leadership for them to make determination what to put in the budget, whether as we need to do market adjustments in the prior year. It used to be very systematic, but what we're finding is movement in the market right now. What's actually happening is we're asked to do up to date more survey kind of reviews, and our leaders are constantly coming back and says, well, what's the real market data right now? And yes, we tell them we got our sources, but they're coming back and saying, well, I've heard this, this, and that. And so we're hearing even more than I've ever heard is, no, Matt, this is not right. Pay transparency and all the job postings are telling me this. And so we're seeing the kind of, yeah, we'll wait around a year. We do on cycle and off cycle adjustments. Now it's almost every single day we get a request. Can you look at nursing? Can you look at this? And so it's almost just in time versus saying, hey, pause, we'll do the review in June. It's almost like we have to react to the market now versus waiting and then putting in all these philosophies about leading and lagging. We have those, but it's really almost just in time what's going on and how do we use our surveys and anecdotal tools to get a recommendation out to the organization.
So it sounds like a lot of things are moving much, much faster than you're used to. What about you, Erika?
Yeah, what really resonates with me, especially with what Matt's talking about, beyond this conversation of are we paying competitively, it's really around what is happening around this employee and what Matt's talking about, because it's moving so fast, right? And Glizcel, you open that, like that turnover in that first year. So things are moving really quickly. And what are the things that are moving quickly for this employee? How is their workload? How is their hours? How is their manager? Are we seeing overtime or absentee patterns? Like that's critical. And I think another thing to really focus on are what are the signals that this person is giving us or this role? Is it becoming a retention risk? And we have to think quickly. As far as healthcare, I think where staffing levels and coverage have such an immediate impact, both the employee experience and the operation, these signals are becoming essentially really, really important in real time. So that's where this connection of compensation insights with the broader workforce data becomes really powerful. And it gives leaders more context to act in the now with what Matt's talking about in order to make these compensation and workforce decisions with confidence.
Makes total sense. So with that, I actually want to open it up to a poll for the audience. I want to know if, in our audience right now, what's your biggest workforce challenge that you're facing right now? And I apologize, there isn't you can pick all of them. There's probably a lot of people that are saying all of the above, but if you had to pick one, it'd be interesting to know where our audience sits right now. I'll give you a few seconds to respond to that. All right, it looks like we've got our results in. So interestingly, it's actually all weighted in the top two. So looking at turnover and budget constraints seem to be fairly even, actually. I'm not entirely surprised about that, but I'm also curious in the other two selections, how those might also have an effect on those first two as well. But it is kind of interesting to see that. Go ahead and stop sharing. So I want to dive right into the next question. What's driving today's turnover and talent competition in healthcare or life sciences specifically? And why is it different from other industries? And I'll toss that over to you, Erika, first.
Yeah, thanks, Glizcel. We did our second year frontline research study at UKG. And one thing that we found, it reinforces just how important this compensation piece is. But pay did come out as the top reason why employees would consider leaving. But what was really interesting was scheduling was also high on the list. And also things like career growth. That was another thing that we found, especially in healthcare. And Matt's point about healthcare is particularly important because when you're dealing with a really constrained pool of licensed talent, losing someone isn't necessarily a matter of simply going out to replace them, right? So the retention question here becomes more consequential. And I think it's so important to really think about how do we create this experience that people want to stay in our organization? And that's where I keep coming back to could we have done and done sooner if we would have known sooner of what to do, especially in this fast-paced environment that Matt opened up for us.
Interesting. Matt, did you have anything to add to that? And I have a little bit of a follow-on, but I want to hear from you as well.
Yeah, so I work in behavioral health, and we have the opportunity to work with, let's just use an example of nurses. So we have our RN nurses and we have our LVNs. But we're seeing that we're having to start staffing more with LVNs because the attraction for RN talent is so different. So these license requirements are really hindering, not hindering, they're changing our business model to try to alleviate some of the work for like an RN. However, we're seeing ourselves staffing more with LVNs these days than we are RNs. And I think it all just has to do with the type of licensure, the competition. Our facilities, acute care hospitals using LPNs. My experience, they use some, but in some of these different specialty settings, like behavioral health, for example, LVNs
Mhm.
are really, really important and are part of the makeup of the clinical team. And our group will determine we can use an LVN for this. So let's do that at a cheaper rate. Or we have to go get the RNs who function in a very different capacity. So those license constraints can kind of hinder at least the business that I'm in today and making sure that we're up to date with what we're trying to recruit for. Because if we're looking at LVNs, very different, RNs very different, but when they do very similar jobs, how do you in the market balance that? And is there enough supply to be able to do that, specifically in like psychiatric type services?
Interesting. So it sounds like in your case specifically some constraints around, although you can see that the jobs would be similar and that you could actually bring some folks in from other specialties, that there's certain constraints around licensing and such that you need to keep up with. I'm curious
Yeah.
too, just to dig into that a little bit deeper.
Yeah.
I know we kind of mentioned a little bit about burnout and whatnot. Are you finding that people are choosing to move from one specialty to another because of those things?
I don't know if I would say movement. I think a lot of it has to do with the acuity of the population you're dealing with.
Sure.
And so when you, and I know probably have some folks that work maybe in acute care type settings or some type of specialty. I think in the world that we live in today, it's, I don't know how to say that. It's, it's become a challenge for us to be able
Sure.
to, I guess you'd say mitigate that. So I guess Giselle, will you repeat that question a little bit? Because I want to think about it.
Yeah, just thinking about especially when it comes to people burning out or dealing with workload
Yes.
issues and whatnot. And
Yeah.
to your point around needing certifications to even switch
Yeah.
specialties, are
Yeah.
we finding that that seems to be a little bit of a trend that they're looking to do that and needing to get those credentials?
I don't know if I tell you they're switching specialties per se, but I think it deals with the acuity of the work you're doing. So in
Yeah.
behavioral health, you're dealing with patients that could punch at you, can do a lot of different things. So I think the expectation of what the role, whether it's an RN, LPN, and the given population they're working with, I think can potentially cause some of that burnout as well. And you all talked about earlier about some of those turnover numbers. Those are beautiful numbers compared to what we see in behavioral health. And
Yeah.
it's just the demographic of people that we're hiring and whether in our roles, behavioral health assistants, LVNs, and RNs, those are typically the top three in the kind of support role along with social workers. And so those are
Mhm.
pretty challenging, especially because of the environment we're asking them to work in, which is more difficult than working in the med surg unit, is at least my perspective over the years. But it's
Yeah,
this type of business that's driving a lot of this. And that burnout is based on those
it's real.
population people for sure.
Yeah. I think the stat that I saw in behavioral health was somewhere upwards of 22, 23%,
It's
in
high,
terms of
yeah.
turnover rate. So that actually foots to that. So
And
I'm
then
gonna,
first year,
yeah, sorry, go
and then
ahead.
I think you mentioned first year turnover, and I think that's where we're starting to see a lot more in our space is
Mm,
really in talking analytics, which is a big thing, is looking at that piece in that workforce planning. I think is becoming even more important than I've ever seen because first year turnover is very, very tough. And then if you get them in the door and get them to stay for a year, you have a better shot to get them to stay 3 to 5 years, which is really where we're trying
interesting.
to target market. It's those types of experienced people. We're not hiring new grads, but it's really
Okay.
trying to get them through that first year. And that's showing they should be able to see is there really true burnout. And it might just be the acuity of the population that's causing that perceived burnout versus not because they're maybe too new to role and they've never experienced that before. Whereas more senior nurses are probably a little more used to it, although they don't like it and they maybe want staff ratios or some other things. But I definitely see issues with the first year turnover pieces.
Okay, that makes sense. So I want to dive a little bit around the details around compensation. So where are you seeing the compensation strain show up first in a large multi-site behavioral health system like yours? Is it in recruiting, retention, somewhere else?
Yeah, I think we receive more of our kind of requests for market reviews, and we see them starting from recruitment specifically because we're potentially our rates or our structures are maybe a couple years old or a year old, but then the market has moved a little bit, and so recruitment is. They're like the lifeblood of the organization. They're the ones bringing in the talent, and they have to have a competitive rate to bring in that talent, which then creates a bigger issue on the other side. So you're talking about retention as you're bringing in people higher than what you have, but what are we doing to retain these people? And do we do market adjustments? Well, on the poll, budget constraints continues to be a big deal. We may know market is saying move, but it's hard to sell the story unless we can show difficulty time to fill in roles. How many denied roles did we have as a result of it? And then really looking deeper into analytics as to why didn't we do that and knowing that internal equity was this. So do we focus on internal equity first or do we bring in someone from recruitment? And so it's almost recruitment drives it and then the business reacts to it and then we have to
Sure.
support it from there.
And if I remember correctly, in some of our conversations, all of the speed that you're having to go about this is leading to things like pay compression and you're starting to also have to think about even how geographic market differences kind of come into the mix too. It gets pretty complicated, right?
Yeah, and I always tell my recruitment leaders and all my business leaders is we in the comp world define the market because that's what we do in
Mhm.
our surveys. And so when we're going in and defining the market, going and doing a geodiff is great in theory from a national perspective because it's easier than having to go into the individual benchmarks and look at the cities and the states and try to see some of that. So what I always encourage my leaders is who are we recruiting from and who are we losing our talent to? If we
Mhm.
understand that, that becomes our new given market that we're having to deal with more so than just the application of a 10% differential because you're in Dallas, Texas, or whatever it might
Yeah.
be. So I'm starting to see, and this happened earlier in my career. I've seen the geodiffs, but now I'm having issues hiring and retaining based on those geodiffs. Because let's just use an example. If you're in a rural market, it's going to be pretty hard to find a director of nursing with psychiatry experience and all these great things that we need in a little rural market. They've got to come into that market. So my market has
Yeah.
expanded. And so how do we deal with that in terms of pay, our pay structures, internal equity, everything? So it's becoming more focused market than I have really seen where we've been national for so long. I think we're doing our company a disservice if we're not going deeper into the market data and being able to define the market and tell that story.
That's interesting because I come from a retail background in my early days of compensation, and it's kind of similar in that it's not so much how you should be paid for this particular job within a particular area. It's who's your competitor. Where are you losing people, to a competitor, and what are they doing? And in the retail world, it's so much more transparent, and in food services and whatnot. Whereas I'm seeing there's a struggle for transparency in healthcare, so that adds another dimension to it.
Oh,
Um,
it's crazy.
yeah, for sure. So I want to dive a little bit more into some of these complexities that we're talking about. You'd already mentioned things around geographical differences and should we even be looking at that, but starting to think about healthcare workforces in particular, knowing that you're spanning across so many different types of workers across your organization, what makes managing pay across all of these at once so hard?
Absolutely. I think one of the most difficult pieces in compensation, base pay is a piece. Is it complicated? No, we kind of know what we're doing in the comp world. I think our bigger piece in healthcare is premium pay. And what I am
Mhm.
seeing in premium pay when you're looking across a national footprint, premium pay, it's very difficult from a consistency perspective to do it all at the highest level. And so that's one piece of when you start to look at these segments in the market and how do we deal with clinical unions. I can't just give you a blanket answer because what happens in Detroit and that given market, or we're a non-union facility, and in the whole market, all the other facilities that are in other companies are all union. So they have very different things that we don't have to necessarily offer, but we can't also compete against those facilities because of that. So premium pay for me in healthcare is probably one of the biggest areas of opportunity for the organization and probably the most challenging across the US for me, at least today, because everyone does it differently. Everyone has different work rules. Everyone has different pay structures, what they care about, certification pay versus on-call pay, those types of things. And we have to look at all of those when presenting a recommendation versus
Yeah.
not. And I'll give you a great example. I hear from our recruiters that tell me, oh, we have a problem with nursing. We get on the phone with the business and we get deeper into that conversation where we're not having problems staffing day nurses or night nurses, but we are having problems staffing evening nurses. And it's because the shift differential is not up to par. And so we're having to go back and say, maybe base pay isn't where we need to go. Let's look at shift diffs. But we're not going to compare someone in Florida all the way to someone in California. We're going to have to figure out what's going on in their market. And that's something I wish some of our salary surveys would do a little deeper dive in the healthcare space around how to manage PRNs. That's a big thing nationally. And then also how to manage premium pay.
Okay. Yeah, that makes a lot of sense. It's interesting because to your point, with the kind of population that you're dealing with, it isn't even so much about what we would consider standard incentives, right? It's more around the nature of their work at this point in time and your ability to basically get people to work certain shifts in certain areas and that type of thing, and having to have some sort of incentives in place to encourage that type of movement. I think just to add to that, from my perspective, it sounds like with all the complexities that we're talking about, tech enablement becomes really, really important, making sure that you've got something that helps you to manage all these differences, hopefully under one roof, so that you're not going to multiple systems to do that. But I think that's just, again, something to consider when you're dealing with a workforce that diverse.
Yeah.
I want to dive into a little bit around the next segue is around like payroll accuracy and looking at frontline employees' experience. How do these connect and why should HR leaders care about the employee facing side of this? And I'll toss this over to you, Erika.
Yeah, thank you. I want to add one other thing on that last question that you were talking about. I think the complexities, we're looking at a workforce demographic that is consistently changing. And, Matt, you're in the trenches of this, so you see this even more, right? So it's really not this one size fits all strategy for us because it becomes really difficult then to defend. So I think the better that you can understand your workforce, and Glizcel, you nailed it, right? You have to be able to have the right insights. I think there's so much data out there, but when we're talking to workforce leaders, it's folks have the data. It's like, how do we organize the data? Do we have the right technology to make sure we have those insights to make those decisions? So we really have to be intentional about where you're investing and the experience you're creating. And with that, I want to go into that, the question you just asked me around, about payroll accuracy in the front line. Time and again will tell you, no matter the industry, especially with frontline employees, right? Our frontline employees not sitting at a desk, which is predominantly healthcare, right? These are folks knowing that they're not going to be working from home the majority. And I think the number one thing that we know, and we know this from research that we have for a Great Place to Work, which is part of UKG, is this conversation around trust. And really is where I take it a step further is that payroll isn't just the end process, right? It's one of the most tangible moments in the employee experience. We have this through many years of data that we've seen, right? We know that like two payroll errors or any of that is going to really create distrust with an employee. But when you think about it in a healthcare environment, you may have someone working a difficult schedule, right? Picking up an extra shift, working overtime, earning differentials. Their paycheck is where all those workforce decisions are ultimately becoming very, very personal. So it comes down to making sure payroll, you're getting payroll done right. And it absolutely matters, right? But what's interesting to me is this broader connection because the experience of pay is connected to the experience of work. And I think that's what we're seeing right now. Like we have generations that are changing in the workplace. We see this, but the expectations of what employees are wanting, that's where we're starting to see some of the changes. And I think that's something really to have further conversations to really think about, what is the technology we're investing so that we can get further insights into what we really need, especially when it comes down to this pay comp conversation.
Yeah, that makes total sense to me. I think especially with all the variations that you're dealing with, and as people are moving in and out of positions that have a shift differential or different types of premiums and whatnot, much more important for them to understand that A, you got it right, and B, it's being communicated clearly so they understand what it is that they're looking at. They understand, what types of pay they're actually being given. This, as I mentioned before, this kind of replaces what I would consider more of the traditional bonus programs and such. And without that constant communication that's accurate, you're going to lose your employees just due to lack of understanding.
Yeah,
Um,
because I want to add one other thing that now that
yeah.
you're mentioning this, that in our study, in our frontline study, we actually asked AI questions. I know everyone's kind of overwhelmed with this conversation around AI, but we
Yeah.
asked our frontline employees directly how they felt about having some sort of AI decisions within their payroll, and folks are on board. There's like an over 70% trust that we found in our study with something like that. It's not saying that the payroll position is being eliminated. We actually need that. We need the compensation experts on the ground, but how can we
Yeah.
help someone like Matt, who is in the trenches every single day with us, to make sure he has those insights ahead of time so that he can make those decisions that need to be.
That's very, very interesting. So it's just the awareness that there's so much data out there that needs to be analyzed, and understanding, even getting into the complexities around your different types of employees, and even an employee that works different jobs at different times within their tenure. It's understanding that in order to analyze that data well, we kind of need to lean into our technology for that. Matt, did you have anything else to add to that before we move on to the next topic?
No, but I think kind of the next topic is going to drive a little bit more around. I always talk about understanding, like we talked about. Well, first, Erica talks about trust. And I
Mm-hmm.
think trust is a huge issue. And I pay attention to that on my side because people have to, I believe, and this is a philosophy I've had for many years, is people don't care about HR. People come to work and they come to work to get a paycheck. We as a business try to engage them to do things. But if you as an employer are worried about your check not being correct, you're
Mm-hmm.
taking that mental thought that you worked at a business and saying, do these people even have their things together? Or I, employee, have to continue to worry about this versus that importance of the employee focused on patient care and not focused on, oh my gosh, am I going to get paid correctly or this shift differential, which kind of leads me into where I always think about is messaging. How simple
Yeah.
can you message? I know we as comp professionals, I'm not going to lie, I'm one of them, is we overcomplicate everything. I see it
Yep.
in incentive plan design, and I come back and I step back. I'm like, if I present this document to somebody because it's changing, are they even going to understand the calculations? Like,
Yep.
and are two examples enough? And I am, excuse me, I am finding that simplicity in our compensation programs is what I'm attempting to build in the Acadia world, which simplicity isn't a poor thing. It's getting employees to understand what's going on because then they can answer surveys and they can do things, or they don't raise their hand and say, I'm leaving because of comp. They understand
Yep.
this is our philosophy. This is how my comp is set up. I get these other things. And then also, I think, and Giselle, you may ask this question. I know we were talking, preparing for it is, having people understand their package beyond just comp. I think that also tells the story and it helps comp just be a component, but bringing in
For sure.
retirement and benefits and career ladders, which we have heard and we've talked about career ladders a little bit, is these are the things people want, but how do we share those with them? So
Yeah. Great
that's
segue.
that's what I think. So
Thank you for that. So actually that segues into our next polling question. I want to understand out of our audience, do you think your employees understand their total rewards package? And again, single choice, but there is kind of an in-between. I'm curious to know if anybody's really on the positive end of this, and to know if you've got it figured out. Couple more seconds for that. All right. Most people are actually in the somewhat range, but it's interesting that there's very few people that are saying yes. Um, so again, not totally surprised. but something that we definitely want to address for sure. And I want to toss this over to you, Matt, just thinking about what does total rewards communications to employees actually look like in practice? What's worked at Acadia or any of the other organizations that you've worked at?
I would tell you the one thing, and if this is a resource, is finding someone that understands change management and is able to help with training and recruitment to me are
Hmm.
probably the things that I would tell you that help make it better because they can come from a place of an employee versus a compensation person going in and trying to create these messages and thinking we're simple when we haven't been simple. So at Acadia, we leverage somebody in our HR team who's very focused on employee communications, really focused on talent management. And so they help us interwork those things into pieces that we're trying to communicate. And I also think about, let's just talk about in healthcare, we have incentive pay, we have our bonuses. How do
Hmm.
those get calculated? And so people need to understand those. And I would be the first to tell you, I don't think we've done a great job, but I've only been there 8 months and I came at the end of those processes. But moving forward, we're going to be more clear as to what's happening. And the more transparent you are, the more less questions you're going to get. And then people will just understand how it is. No different than you working for the federal government and they have these massive ranges and you're in grade 6 and then you go to grade 9 and you do this. Everybody knows in the government how to move up because they see, maybe they don't know, but they have the ranges, they're all published, you can see everything. Whereas right now, the transparency pieces that we do not show, I think prevent our employees having full trust. And so we have to
Yeah.
break that segment within communications and change management and get the right people to help us do that. Don't just throw a comp person in there and try to do it because a lot of comp people are better analytics versus communicators. Doesn't mean we're not both. I think I'm good at both, but having somebody who's really good at it really helps out. And I joke because I'm a chat GPT person.
Communicator.
I use AI when I'm trying to communicate. So I think that also
Yeah,
helps. And it does help put a framework together. If you know
for
what you're
sure.
talking about, you can use those tools. But we also use people because they understand and they got to tie it all. And at our conference, when we had it, is the employee value proposition, tying things to that EVP, employee value proposition also becomes a big deal and allows us to be more transparent with our practices and what we're trying to do and the why behind it.
I'm going to clue in on a couple of things that you said, and I was going to mention this earlier, but you brought it up perfectly. The idea of transparency actually leading to or equating to trust, I think, is super important. And to your point around the clear, concise communications, however complex or simple your programs are, if you can't communicate it clearly to your employees, they're not worth anything. They're not motivating them to do anything. There's no behavior that you're actually driving aside from confusion that they might get. But that would definitely be a sign that any of your programs may not be effective if they don't understand them. And just a recent experience that I had, I was at a particular total rewards leadership conference recently, and for the first time, I actually had somebody in one of my roundtable discussions that was not a compensation professional or a total rewards professional, but was more on the organizational development side and actually education to their employees. And that's why she was sitting in on this particular conference, because that organization that she worked for was going through a major transformation into a pay for performance model. And to have somebody that invested in understanding what we do in total rewards and compensation to be able to then do that clear communications, to your point, somebody from the outside of the comp world that doesn't live and breathe it all the time, that can communicate it in a way that it makes sense. um, Erika, I don't know if you have anything else to add to that, just based on your background too.
Yes, I think, coming from that org development side, I think that's critical. And y'all were touching on it. I think it's important to remember that employees are not experiencing value through an HR spreadsheet. Like we
Mhm.
love the data. And Matt, I don't know if you love HR spreadsheets, right? We're thinking about this, but we really have to think about it in the lens of the employee. And it's exactly that. What does this mean for me? What does this translate for me as an employee? And I think that's the critical piece, is being able to communicate it in that. And that's how you create trust, I think, beyond total rewards. And personalization without any type of relevance really is just more communication. So we really have to think about it in
Yep,
that way.
makes sense. So going into a little bit more around the compensation side of things and thinking about pay for performance within healthcare, how do you design it so it feels fair and motivating to your clinical staff, to other parts of the organization, and not just corporate roles? Because I think we tend to think about, especially performance related type pay, to be more applicable to corporate and that type of thing. But now start thinking about it within your field. Matt, do you have anything on that particular topic?
Yeah, and all the healthcare organizations I've ever worked for, and there's been about four, we've always talked about pay for performance. My
Hmm.
challenge to every one of us, and knowing that going back to budget constraints, pay for performance does not work if you give a 2% increase. Somebody
Right.
getting a tenth of a percent to just even it out. So I think in healthcare, staying up on kind of what's happening in the market in terms of merit increases using your resources like a world at work or sort of other resources that come in and really start to look at that because I think you have a better job of tying pay for performance inside of short-term incentive or long-term incentive. I see that being a really big trigger for pay for performance because you're both doing company performance and then the individual component of that performance. And then, of course, long term, really obviously that retention period really makes a difference. I think, and I think maybe I'm crazy, but to staff level, when you're doing a 2% increase, it's hard to spread it. And people don't necessarily understand at 2.6 versus at 2.9 and why is my pay different? And we're starting to build with all these boundaries in place. So I think we as comp people have to start to think about even further is what does pay for performance mean with base pay? And is it
Mhm.
just the merit increases going in, or is there other components within a career ladder that you build to actually go in and influence and go into actually see pay for performance because you're able to do it a different way, not a base rate increase? And I'd love to ask the audience if we ever did was, I mean, I see 5% being a lot more of a differentiator amongst a group than a 2 or
Sure.
2.5%. Because if I
Sure.
got a 50-cent raise and my peer that has 2 months more or did pretty much the same thing, but the boss liked them a little more, gets
Yeah.
3%, like now you're running into too much subjectivity. And I think that pay for performance either needs to be a little bit more, not, I hate the word linear, but more goal setting, accomplish the goals, and then really what are we going to reward with? And we can't just say base pay anymore because
Yeah.
I think it's kind of BS. And anybody that
I would
logically
agree.
thinks that from the employee
Yep.
perspective, I kind of just chuckle. We do it. We have, and a lot of most healthcare organizations do it. But I always
Right.
challenge people is from the pace of an employee, if you give them 10 cents because they're a lower level employee, is that really managing their performance at a star or they get 25 cents? I'm not really sure that drives a whole lot, but coupled with culture and some of these other things, we might be able to get away with it more. But I just don't think it's a good standalone. And I
Yeah.
just not with 2.5%. I just don't buy
That's
it.
interesting. I actually had a recent conversation with a company that had completely gone away with any kind of performance related increases aside from the exceptional, like you're getting a promotion or whatever.
Mm-hmm.
But for the most part, in the organization, they basically, they knew the budget was needing to go up because market was going up and they made their adjustments based on market adjustments. But aside from that, everything else from a performance perspective was actually tied into incentives instead. So, to your point around short term goal setting and payouts based on those goals being met, that's really where they leaned into the pay for performance model. And I think part of the challenge was also in all the conversations about pay equity and studies that are being done. And we're trying to keep up with the market in the first place. And we're also trying to ensure that we're not creating any inequities. Once you start building performance into it, sometimes it muddies the water a little bit because, to your point, there's too much subjectivity, even if you set some guidelines. So that was kind of an interesting approach that might be a little bit different. I would also just say, knowing that again, in such a diverse organization as yours or any other healthcare organization, to your point, Erika, one size doesn't fit all. It's knowing that you've got to have potentially different strategies for different types of workers out there. What you need for your frontline workers is very different from what you need in the corporate back office. And being able to have the technologies to deal with those differentiations is super important because otherwise you're back to spreadsheet world when you're having to deal with some of that. So that's kind of, again, where we see the value of, the combined UKG and HRSoft platforms, and looking at those nuances that we can actually manage to a little bit more cleanly and better when it comes to incentive programs and such. The next area, just to dive a little bit deeper into different types of incentive programs, and you kind of touched on this already, Matt, but thinking about the competition being so fierce in your industry, how important is some sort of a sophisticated LTI plan and the management around that, deferred compensation programs and such, in winning and keeping that talent? So from not just a retention, but even recruiting perspective. And I know there's a lot of debate around that, but I'd like to hear your take on that.
I always like to say is at the leadership level, and we'll just call it maybe director and above type levels, those roles, they're strategic in nature and they're the ones driving the work of the business. And I do fundamentally believe that long-term incentive to retain these people becomes even more and more important, because these are a lot of things I've read is people leave because of their leaders. That's a big thing. They don't. But if you have a solid basis of senior leaders and you have consistency, you don't have a lot of turnover, it continues to build trust. But you have to reward these leaders so that they have a carrot, like that, the little carrot that you're out getting them. Whereas I think in those leadership levels with long-term incentive is really important. I think short-term incentive is also important for your frontline leadership to help motivate them and tie performance metrics. I think when we get to staff level, that's when we start getting challenged, because we don't offer, you're not getting all bonuses and you're not, I mean, some organizations might do that. It's not a common practice in my organization, although it does happen and it's normal. And we do those, but it's really starting to look at levels. And what are we trying to attain? And instead of kind of like we've been talking about no more blanket approaches, is what are we going to do to maintain these VP levels because they're adding XYZ value? And is our long-term incentive equity program supporting those growth, that strategic plan? Because leaders look 3 years out, frontline managers deal with kind of day to day to maybe 1 year out, and then our staff comes to work. And the last thing they're thinking about is 2 years down the road, I'm going to get this. They're kind of more in the day to day, and they're so used to just getting bonuses. So more on the LTI side, I see it more on the leadership level. And I think that's really important to help drive strategies down, and less turnover at leadership, the more stable the workforce feels.
Sure. I'm curious if you're also seeing, maybe not at Acadia, but maybe other places where LTI is being looked at for lower level leaders as well. You mentioned like typically director and above, and I think that's the typical cutoff that I see. But are you starting to see it as potentially being a retention tool elsewhere?
Not in probably the last companies that have offered LTI that I've worked with. I pretty much have seen it based on levels. So I actually have not seen it tier down as much. It's interesting thought process is, could you tear it down? I think what we end up using is retention bonuses versus like an equity type based program for those lower levels. And for the higher levels, kind of using stock equity, but those lower levels, that retention and those retention periods, we see that more. Although I always tell people is retention, we can always go back and forth with our competitors about sign-on bonuses and retention payments. Those,
exactly.
Those are like the triggers, and it's always competition. And that's why I've always been reserved and said, do we really need to do this? Because I'm like, hey, just because hospital down the street's giving a $30,000 this, and we're sitting here thinking, well, you can't afford to do that. We're not going to get in a bidding war over that. But in the conceptual design of a program, definitely something to think about is, do you do something between short term and long term? Maybe it's a cash incentive, but it's still tied to company, in a public company, tied to that performance, maybe a phantom type stock. And then you actually then do a different equity type program for different levels, up to stock options, RSUs, whatever it might be. But looking at it more in detail, I think is becoming more important. And I think you bring up a good point of, what if we decided to offer equity down to a manager level? What would that look like? What would that cost us? And does it add value? And that's the key piece. Is this adding value or not? And just because you have the program doesn't mean it's working.
And I think to add to that too, I mean, I think what I've seen is more cash-based type programs, but over a longer term. So
Yeah.
acting similar to some sort of an equity program, but it's based on longer term success in the business and maybe, split up over a multiple series of
Yep.
years or months or whatever the case is. That kind of makes sense. So you touched on value. Erica, I want to toss it over to you to just talk about, we've been talking about communications all along, and I think you've got some insights into communication and value around the communications too.
Yeah, I think what stands out to me here specifically is that you can have the right reward strategy and it can seem like perfect, right? And you're going to roll this out, but that's only part of the equation here, right? The
Mm-hmm.
employee, as we talked about, has to understand it, but they also have to experience the value of it. I think that's the piece that we know when we're talking about value. How are they experiencing this value? And in particular, when you're competing for such high specialized talent, right? And especially in this industry, you're not just competing on what someone is earning today. And I think that's important to remember. You're competing on the broader value of this proposition, right? What they can build, what are the opportunities that they have? Why would they want to choose to build their career with your organization? And like, what is the reason to stay? And I think that's this piece that, Matt and I were talking about earlier about this communication, and it becomes really important. So a reward that an employee doesn't understand isn't a reward. It's really
Mm-hmm.
it's very difficult for them to even get the value of it. So I think this is where employees need to understand how the decisions are made, what they can influence specifically, and how do they believe this process is fair. Like they have to see this. And one thing Matt just touched on, and I think this is critical to think about. I think there was such a focus on frontline, especially we saw it, during the pandemic, post-pandemic, on the frontline employee. But there's this other component here is the manager. And the
Yeah.
frontline manager becomes incredibly important here in this. You can design a brilliant program centrally, but the employee often experiences this program through a conversation with the manager. So the quality of that manager conversation becomes part of the conversation itself. You really have to bring your
Mm-hmm.
biggest cheerleaders and make sure they're also understanding the managers on what's happening here, because those are going to be
Yep.
your components into having a successful program.
Yeah, that's something I'm hearing very consistently is that it's one thing to be focusing on how we're communicating, whether it's in writing or through a portal or whatnot around an employee's total rewards picture. But the education of the manager is so critical there because they are likely their first line of defense when it comes to having any kind of questions and whatnot before they even reach out to HR. So it is critically important for the managers to also have a great understanding of that. And one thing that I've seen is some focus on not just manager training, but also even if you're utilizing any kind of tools to have a manager version of what the employee sees that has some of those talking points built into it, but really diving deeper into that and actually educating those managers on your compensation philosophies and strategies that you're putting out there and understanding why they exist so that the default answer is not HR told me that this is the way it needs to be.
Yes. And I mean, you're nailing that. So like making sure that technology piece is able to guide the manager to have that conversation. We can't expect them to be healthcare experts, like out on the ground, dealing with all of these complexities. And all of a sudden you need to
Mhm.
know HR and everything, know everything of,
Mhm.
Matt's knowledge into the mind of the manager. Like that's a lot
Right.
to ask. So making sure you're having the prompts in order to build those into those equity discussions.
Yeah, that's huge. So we touched on this next topic a little bit already, but just thinking about data and benchmarking, and actually we've kind of touched on it throughout. How should HR and comp leaders be using up-to-date benchmarking and analytics to make faster, more confident pay decisions? And Matt, I know that you really dove into this a little bit, but just kind of wanted to reiterate how this looks like in your organization these days. Do you think this is actually a trend throughout your industry, or is it something that's specific to your organization?
I think it is a trend throughout everywhere, to be honest. I think we're all in different journeys.
Hmm.
And also, I think leadership wise, and this may be something crazy, is AI is changing the world in our businesses,
100%.
and things are becoming the expectation is becoming more data, use AI, do this, do that. And
Hmm.
so I think an organization's willing to adopt some of those types of technologies is a big deal. But then I think everyone's in their own journey. And I think it just sort of depends on what is the end goal. Like we talk about pay transparency and bigger than that. That's one of my strategies for the end of 3 years is how I get Acadia to the 3 year transparency so we can just completely do that. But we can't do it until we fix some of the foundational things. And we
Yeah.
can't just advertise. So there's a lot of work that goes into it. But I would say everybody, there should be it's probably more cross than it is just Acadia specifically.
Yeah. I think that makes sense too. And to your point, everybody across every industry, any worker out there is entrenched in what AI can and can't do for you. And I think there's two risks that the compensation and HR teams probably need to mitigate around that. It's the availability of so much information at your fingertips
Mm-hmm.
and not knowing how to ask the right questions about that data to get answers that make sense. And it makes it that much more important for the compensation teams and the HR teams to be very clear and concise in your own strategies and philosophies and where are you getting your data from and how are you making the decisions that you're making, because everybody becomes an expert with AI, right? Kind of to touching on a point that was made earlier, like they're healthcare experts. They're not HR experts, but they might pretend to be if they start asking AI. So we have to be super cautious about the kind of messaging that we're putting out there and making sure that we're educating managers and employees appropriately. Okay, so I want to dive into our last polling question really quickly. And we're on the home stretch now. So what would have the biggest impact on retention at your organization? Just opinion. What do you think out of these four things? Better pay transparency, more competitive pay, clearer career planning, pay for performance paths, or reduced burnout and workload. And I think based on some of the responses we heard earlier, I'm guessing where this is going to land, but it would be interesting to know where our audience is. All right, interesting. A good majority are looking for clearer career and pay for performance paths. So this kind of foots to some of the things that you were mentioning earlier, Matt, just in terms of having clearer paths in terms of that strategy, the leveling and setting your goals and what it takes to make it to either the next level or to get that incentive pay that may have been designed for you. So that's actually really, really interesting. And that all foots to some of the communication things that we've been talking to so far. So with that in mind, Erika, this question is actually for you initially. What is the research showing about the link between compensation, engagement, burnout, and retention? And what surprises HR leaders the most, do you think?
There's a lot of research showing that pay matters and fairness around pay matters. I think we see that there's been a conversation. I'm based in Colorado. There was I was working in HR during this conversation. I remember when the whole pay transparency took over during our world of work. So, but
Yeah.
compensation does not operate independently from the rest of the work experience. And we have to remember that. And that's a piece that I think that is important. Experience isn't the soft stuff that happens after compensation.
Mm,
Experience is the work itself. So we really have to think about, do I have enough people on my team? Does my schedule work? These are what folks are thinking about. Does my manager support me? Do I have opportunities to grow? Is my paycheck right? Do I feel recognized? These questions are all things that are part of the experience of work. And so I think sometimes in HR, not really a surprise, but I think we don't think about enough is we sometimes discuss compensation and engagement, burnout, and retention as separate HR issues. They're all
yeah.
individual things, right? But to the employee, they are one experience. So Matt could be dealing with compensation and that's his expertise, but to the employee, that is the overall part of their employee experience. And, I meant to ask you this earlier, Matt, how often do you get a phone call where an employee says, hey, Matt, thanks, I got paid correctly today, right? Now, Matt's usually getting the other type of phone calls or the other type of questions around on what's happening in the world of work. So I think we have to remember that from the employee lens. And that's often, that's often what we forget. And that's where clearly the research is pointing us to.
That's very interesting. I would totally agree with that. I think it's interesting to actually push the narrative that we have the holistic view always, regardless of where your specific area of specialty is. And that foots to having more, I'm going to call it centralized, maybe more cohesive communications across the different areas of expertise, and making sure that whether that's a way that you're actually communicating all of these things and these strategies and whatnot all together, or if it's just a constant messaging that's coming from all sides of the house. I think that's super important. Matt, did you have anything to add to that too?
You know, I agree that we got to start looking in more than just pay, base rate pay.
Yeah.
We are now, I always talk about my peers. I'm part of a collaborative leadership team. And that's just absolutely important because we're all coming from different components and we're also bringing different experiences. Like our employee experience leader is telling me about burnout. And then I'm looking at the market data and I'm like, well, no reason they're burning out because we're not paying them enough or we're not utilizing PRNs in an effective way. And then framing that all up for the business, because at the end of the day, the business is not going to just approve, hey, I need salary increases. They're going to want us to bring these other components into the business case to be able to say, we know this is happening. We know this is happening. So comp people have to become more data analysts as well to be able to start to bring those together. So kind of to Erika's point, it's all inclusive and we should be looking at that from recommending salary increases up beyond just, hey, market data says this, pay range is this, but more so tell the story. We're losing 30 people. We know that people mentioned their exit survey, they're burnt out or they don't have career development. And so you start taking all these analytical pieces that helps build up your business plan. And that's something we are doing in my world now is it isn't just about the market rate. It's about the big picture and what's in it for the executive because they're looking at dollars. The CFO is always going to look at dollars, but the
For sure.
CEO is hopefully going to be looking at a bigger picture. And then with those two individuals and some of those entities, it can be balanced, but we can't just do one segment.
Yeah. So I'm going to stick with you on this next one. Just curious, kind of piggybacking off of that. If you could get one piece of workforce intelligence in front of your CFO or your CHRO tomorrow, what would move the needle the most, do you think, on retention?
You know what I think? I think it's being able to predict out how many people are leaving and the why. And I always like to say is I call them retention risk data. And so being able to forecast the risk and looking at historical to see what's been going on and comparing it against increases over time, I think that tells a big story for our executives. I think we've been trying to do this for years is what's the cost of turnover? And we can't seem to get a good consensus across the industry because so it's almost like, do we dial it back to our organization and try to determine like the cost of turnover? Because that at least gives the leaders the soft idea of what's going on. But our seasoned leaders understand training costs. They understand orientation. So maybe not an exact number, but mentioning that in the analysis and what's the state of what's happening in those hospitals, that they're going to be like, oh, Matt, okay, we did have a turnover problem. We had a recruitment problem. Do you know how many people, if we're going to predict to bring in 3 to 5 year nurses, what's that going to cost us? Those types of things.
Perfect. Erika, what about you?
I think is what Matt's talking about. Can I identify a risk in a critical population, right? This is something we talk a lot about at UKG is understanding the signals of what's contributing to it. Get the insights to a leader early enough to act. We have to have it actionable. And this is really when we move from having just workforce intelligence, but really becoming business intelligent. And I think it goes back to this question I talked about earlier. What could we have known sooner? Because by the time someone has resigned, the insight is interesting, but they resign, but why they resign, that's when it becomes valuable. And something we talk a lot about through our DWO here, Dynamic Workforce Operating System at UKG. Like we really have to know those insights, especially for our frontline, because we don't have time to be digesting 500, data sheets that I just talked about. It's like, can I have those predictabilities to create the action that I need, depending on the kind of leader that I am? And so I think that's the most important piece is making sure that we're able to have actionable items.
Perfect. And to close this out, I just want, where it looks like we're right at the top of the hour here. I want to just leave everybody with a quick one-liner from each of you. One action item attendees should take away this week out of this seminar that we've done. And I'll start with you, Erika.
Okay, I think for me, I'll pick one critical workforce question here is, what could our data tell us today that we normally wouldn't discover until someone leaves? I think that's critical, is thinking particularly that. What is that data piece?
What about you, Matt?
So I'm going to give you a statement. I got a chance to write it out, but something for HR leaders to go back in is, I would say first, well, the statement I would say is identify your highest turnover position, identify your hardest to fill position, and assess whether pay, workload, or career opportunities are creating an avoidable retention risk. So using those three pieces of data and then going back and saying, what's correlating, what's not? And sometimes it's okay to use some statistical analysis to sort of drive correlations and different things like that. But that's what I tell an HR person is go start identifying these problems and then come talk to comp about, is pay really the problem or is there something else going on?
Perfect. And I think from my perspective, just looking at things holistically and ensuring, it sounds like compensation, communication, and strategy are the key. Really clear, concise communications around the total strategy and making sure that the education goes hand in hand with that. Sounds like it's absolutely essential.
Absolutely.
All right. Well, thank you so much. It looks like we've actually gone a little bit over. Thanks for those of you that have stuck around. I'll go ahead and pass it over to HR.com.
Thank you. This concludes our webcast today. I would like to thank all our presenters, as well as all of you for joining us. Just a reminder to the audience to fill out a quick feedback survey that will open on a new tab on your screen. It only takes a few minutes, and your valuable input is key to improving the quality of our webcasts. Thanks everyone for joining in today, and have a great rest of your day.
Thank you.